evolution in the management of atopic eczema in the past few years has been considerable. It's crucial to emphasise the potential solutions available for individuals coping with the condition, as this enables them to receive the appropriate support and care necessary for improving their quality of life. Sanofi is spreading a message of optimism that there are solutions available and managing the condition is possible.
Smiling, happy, enjoying time together. But not too long ago, Andrew was in a very different place. His atopic eczema, which he's had since being a baby, flared up and he felt at the edge, both physically and mentally.
Last year in January, I had the worst flare-up of my life, so I was covered head to toe in rashes. I was covered in weeping sores. The weeping sores were so infected that I was shivering, like almost feverish. I was getting sort of 2 to 3 hours broken sleep a night, and this was for months and just wouldn't dissipate. I felt like I was absolutely on the edge, psychologically and physically. I just felt to my limit. And in those situations, it's not just the physical symptoms that need to be really assessed by the healthcare professionals. The full picture needs to be taken into account, because that is where I believe the real emergency is, and where the urgency is when people's mental health is as damaged as it can be.
And while Andrew has now found the right treatment which has transformed his life, the memory of his experience with others, from friends to strangers, has made him determined to raise awareness of atopic eczema.
Every social event or major life event is underpinned by a sense of panic, and it's just always very anxiety inducing. That you can wake up on any given day despite doing your full routine and your skin has flared horrendously. If you have to go and spend your day feeling absolutely mortified in the way that you look, it just really damages your mental health and creates a real sense of anxiety. So I'm on a treatment at the moment which has just changed my life. While my skin certainly isn't perfect by any stretch of the imagination, it's controlled to a degree that I can live a normal life to a level that I'm happy with, which is all I've kind of ever wanted, really.
Listening to patients, engaging with industry experts and working collaboratively is what brings the best results. The evolution of treatments and solutions through companies like Sanofi are bringing a holistic approach which can offer hope to many. And to get as much information as possible out there to raise awareness.
Every patient has their own unique story, so it's really important that we really hear the patient voice and that we really understand the patient need when we're looking at how we can treat patients in the most impactful way. So we actually just recently published a report with the think tank Demos called The Hidden Costs of AD. People lose a lot of work days, they have to spend a lot of their own personal money on going to buy various different treatments. The direct cost of atopic eczema to the health service is around £250 million a year.
Finding help and resources can be a challenge in itself, but as more companies collaborate, more options become available.
Unfortunately, stigma is still experienced by patients. People not being quite sure of someone's skin condition, still thoughts of, is that contagious? Could I catch it? I think that there's still quite a lot of work to be done when it comes to the general public. There are resources that you can look for. The British Skin Foundation is actually working on creating more resources for our supporters. People want to be and need to be treated holistically, so it's not purely focusing just on their skin, it's focusing on how that has an impact on their psychological well-being as well.
Considerable progress has been made in the management of atopic eczema in the past few years. Healthcare professionals now have more access to information and treatment options. Those living with atopic eczema feel a holistic view of their well-being, including their psychological state, is key to raising the standards of care. As for Andrew, his treatment has really been the key that gave him hope and a better quality of life.